today we are going to be doing some low body flexibility. We need a chair today. I will be modifying for you if you need it. So we're going to start by stretching out those hamstrings. So I want you to just kick that foot forward and forward. So I'm just touching my knee, so there's not a big rotation here. All right, we're just warming up those hamstrings. So we're going to do a little warm up and then we're going to hold a stretch. So again, for my osteoporosis crowd, tap your knees. If you are part of my Parkinson's crowd, I want you to try to reach for your feet. Okay? So, low back pain, osteoporosis, we're modifying to the knees. Anyone else can try to reach towards the feet. That just increases the rotation a little bit. Okay, great job. We're nice and warmed. We're going to plop, holding onto the back of the chair, that hamstring up on a chair. So what I'm going to do, if you need to continue to hold on, you can use the chair or you can hold on to a wall or countertop. We are hinging at the hips. So tummy tight, pressing the hips back, and you should feel that stretch coming from your calf muscle all the way up to your hamstrings. What I want to make sure you're not doing is this. We're not bending at the back, especially if you have an osteoporosis diagnosis. That just puts way too much pressure on your vertebrae. So, hinging at the hips. If this is too high or you do not feel safe, kick your foot on the ground and hinge at the hips. You're still going to get a great stretch, okay? So, floor or chair, and we're stretching. Now I want you to keep the stretch and add some ankle pumps. You may feel some zingers shooting all the way up your leg. Completely normal. We're doing what's called a sciatic nerve glide. This is wonderful for your sciatic nerve. Great job. Stand it up, and we're going to switch sides. Again, holding onto the chair if you need to. You can prop your heel on a chair or heel on the floor, but we're hinging back. So, pressing the butt back. I do not have to go far. I'm getting such a stretch right like this. If you're more flexible, I'm going to bend my knee a little, but if you're more flexible and can hinge forward further, that's fine. I cannot. So we're just holding, tummy tight, gaze is forward. Let's hold this for another 10 seconds, then we'll add in our ankle pumps. All right, let's add in those ankle pumps for 30 seconds. So for me on this leg, I must be really tight today because I'm getting some zingers that go from my heel all the way up to my glutes. That's okay. We have about 10 seconds left. Beautiful job. Bring that foot back down. I'm going to bring the chair in front of me. So stand in front of your chair. If you do not have the osteoporosis diagnosis, you can stand and you can touch the floor. So, floor to ceiling, floor to ceiling, all right? For the osteoporosis diagnosis, floor or chair to ceiling. Just moving gently. You do not have to touch the floor. If you're getting a stretch by touching your knees, like if you're just getting a stretch from here, then that is great. Keeping that back flat, open and close. In. You're doing great. And we're going to drop and hold. So for the osteoporosis diagnosis, I'm going to move my heel toe, my feet a little closer, press my butt back. If you're hanging to the floor, your feet can be a little wider, and you're just hanging. You're going to feel this all the way up the backs of your legs. For the osteoporosis, you'll feel this in your hamstrings. And we're going to bend the knees, and we're going to bring it all the way up. Great job. All right, standing in front of our chair, let's step back with the right leg. So, right leg is going to face the mirror, or the camera, the video, and your other toes, your left toes are facing the chair. Okay? So you're in a nice deep lunge here, and then we're going to press up. Down and up. Nice and slow here. Down and up. Now I'm going to add some arms. Down and up. Down and up. You don't have to add the arms if you don't want to. Doing great. All right, we have one more down and hold. You're going to feel that stretch on the inside of your thigh here. Tummy tight. Hold for just a moment. Then I'm going to pivot on my back foot. So now my foot is facing forward. I stumbled all over my words earlier, but it's facing the video. And what we're going to do is we're going to rotate back, hands to the chair, and nice deep lunge here. You should feel a nice stretch now in that hip flexor. And hold. All right, you can stay here or you can slowly drop that back knee to the floor. You may need a pillow underneath of your knee, but we're just gonna push forward and release. Forward and release. Really stretching out that hip flexor here. If you're up in this position, you're just pressing down towards the floor. Down towards the floor. Great job. Bring it together. Stand up nice and tall. This is a workout as much as it is flexibility. So now we're going to step. I'm going to move my chair. You do not have to move your chair. I just want to be facing the camera for you. All right. So we're standing at the foot of our chair. We're going to step back with our left leg now. So really big step here. Let's rotate your toes on your left foot towards the front of the room. Toes on the right foot towards the chair. And we're going to lean into this lunge and straighten the leg. Nice and slow, nice and controlled. What I don't want to see, these knees should not go over the toes. All right? This knee should line up on top of the ankle and straighten. If you happen to look at your knee, it should be trailing over your toe, over top of your toe. We shouldn't have your knee going forward or behind your foot. So, over the toes and back up. Let's add some arms. Bring them up and down. Just a couple times here. Again, you don't have to add the arms if you don't want to. Down and hold. You should feel that stretch in your inner thighs here. Now what we're going to do is we're going to pivot on that back foot. So we're going to twist, and now you're facing the chair. So I'm going to show you how to do this stretch, and then I'm going to drop down to the floor. So what you're going to do is press the pelvis towards the floor and release. Press the pelvis towards the floor and release. If you feel comfortable, drop that back leg nice and softly to the ground. Press forward, tuck the pelvis, and release. Really just stretching out that hip flexor. You're doing great. All right, tuck those toes and lift it back up. Straighten the legs and raise your arms overhead and down. All right, this one's going to be a doozy. So I'm turning my chair around. If you have difficulties with balance, you can just take a seat in the chair and I will show you the modification. So we're going to crisscross our left ankle over our right knee. And we're going to have a seat into a deep squat. All right, so going up nice and slow, coming down and holding for about 5 seconds. And then bringing it up. If you have balance difficulties, just have a seat in the chair, crisscross over, give a little overpressure into your knee here. And release. Okay, so you can do this either way. There's no pressure. The other one just adds a little more dynamic to it. So, crisscross over, down, and up. Hold for just a few seconds, and bring it up. I know you all are doing amazing. You're probably thinking I'm crazy right now. And that's okay. Stretch as much as you can and up. All right, let's move to the other side. Crisscross, butt back, and up. If you're in the chair, just switch legs, little overpressure, hold, and up. Doing great. And bring it up. Great job. Shake it out. Okay. Facing the camera, or facing the computer, I want you to take your right leg behind the left. So what we're going to do here, again, this is a little balance, so I really want you to have the chair beside you for balance. You're going to take your right hand, so right leg's behind, right hand, you're going to reach it overhead and bring it back. Nice and slow, push and bring it back. We're stretching out that IT band. Pressing that hip out. Couple more times here. You may be getting a nice side stretch too. And hold. Bring it back up nice and tall. We're going to move to the other side. You can turn around. I'm going to turn my chair. Left leg behind. And we're going to press our left hip out. So stretch and back. This should feel really nice. We have about 15 seconds left, and we're going to hold, and we'll be all finished your low body flexibility video. I don't know about you, but my legs are feeling more flexible. And hold. Push that hip out big stretch. Try to get your arm to line up with your ear so you're really opening up that body. Hold. And bring it back. Way to go, and we'll see you soon.